Hello everyone, I am Sai Manikanta Yerram, pursuing Masters in Data Science at the University of Maryland, Baltimore County. In this video, I'm going to talk about my Data 606 capstone project. The topic is predicting the utilization outcomes for home health agencies. Now, before discussing about what a home health agency is, let us discuss about home health care. So, home health care is basically a system of care provided by skilled practitioners to patients in their homes under the direction of a physician. Home healthcare services include nursing care, physical, occupational, and speech language therapy. The goal of these services are basically to improve function and live with greater independence, to promote the client's optimal level of well-being, and to assist the patient to remain at home, avoiding hospitalizations. Now, coming to what a home health agency is, it is basically an organization that is primarily engaged in providing skilled nursing services and therapeutic services whose policies are generally established by a group of professionals. People with medical conditions or disabilities often take the services of a home health agency as an alternative to our conventional nursing home care. The services offered by an agency depends on the agency itself, and an agency can be a public, private, or a proprietary organization. Now, let us get familiar with the topic. Home healthcare has the potential to drastically reduce the healthcare spending and lower readmissions for patients following emergency room visits. For example, if we consider a recent study, patients involved in the study received home health care immediately after going to the emergency room and had a total cost of $13,000 for 90 days compared to $20,000 for patients who were treated in the hospital. The goals and the multidisciplinary nature of these services present challenges for quality measurement that differ from those of a traditional hospital setting. As a result, quality improvement organizations and providers are working to identify performance measures that prove to be effective in home care. Therefore, utilization outcomes such as emergency room visit rate and hospital admission rate have received particular importance due to their associated cost and health concerns. In resource constrained settings, it is very important for the home health agencies to maintain the quality of care, avoiding patient hospitalization. Therefore, it is very important to understand the relationship between the characteristics of a home health agency and the utilization outcomes so to provide targeted improvement initiatives for the organizations. Now, the aim of this project is to provide suggestions to home health agencies to focus on and prioritize improvement initiatives as it is very important to maintain the quality to prevent patient hospitalizations. Now, let us talk about the data. The data required for the predictive modeling and understanding the relationship between the utilization outcomes and the characteristics of an home health agency are available from the home health compare datasets, and patient satisfaction can be obtained from the home healthcare consumer assessment of healthcare providers and system survey data. Both this data is published quarterly for all the home health agencies in the United States under the Medicare program, which can be found on the Centers for Medicare and Medicaid Services website. The dataset contains around 11,000 rows for each quarter from 2010 to 2020. The number of columns may change over time as measures were added or dropped from the whole home health compare data. Using this data, we need to find the relationship between the characteristics of a home health agency and the utilization outcomes. This is the planned workflow of my project. I will be collecting the data from the Centers for Medicare and Medicaid Services website, where I will be extracting the provider data from the available archived files. The collected data goes through the pre-processing step, which involves data cleaning and feature selection, preparing the data for the next phase. After that, I will be feeding the data to supervised machine learning models such as linear regression or regression tree approach, and I will be evaluating their performance using cross-validation. After that, I will be comparing the results. This study can help in providing improvement initiatives by outlining the gaps between the utilization outcomes of the home health agencies and their associated characteristics. Thank you. The code will be available on GitHub and it can be accessed by the below link. And if there are any queries, you can email me at the provided email address.